Right now, there's a lot of panic, there's a lot of despair, and people are sick, they're dying. There's a lot of helplessness going on, and this is not only because of the fact that COVID is killing people, but it's also because there are medical facilities which are getting saturated, and we're not able to really give it to everybody, and that is probably one of the main reasons why the pandemic is, pushing us to where we are right now.
And are you having to turn people away who are coming to the hospital? Are there no beds left?
Sadly, yes. Um, there's only that much that one hospital can do, and the cases are so much, they're so enormous that I am not even left with a chair to make a patient sit at times. So I am helpless in that way, and I have to say no. You know, the I have to say no a lot of times. And in the first phase of the pandemic, which was last year, there were enough hospitals beds because the cases were not that high. So, initially, like 10 days back, I would tell patients, I'm sorry, I don't have a bed available. I don't have a ventilator available. You will have to try at another center. But now I can't even, I tell them that, but I don't believe it myself because I know there are no beds available anywhere. So I know they're going to struggle. I know, uh, I know a lot of people are going to die.
How has it been mentally for you as a doctor working on the front line? What is it like having to turn these patients away from care?
So it goes totally against what we've believed in, or what we've been taught. The reason why we became a doctor, the fact that you want to help people and do no harm. So this goes totally against it, and it is extremely draining emotionally. Um, you know, uh, Talking to them at the door and denying a bed. They're crying, they're in tears. They're like, "Please save our patient. He's going to die," and it takes a toll on us. Um, at one point we might become mechanical, and or maybe stone-hearted, but at the end, which is probably needed. But at the end of the day, when you get back home, when you're lying there on your bed and trying to sleep, all of this comes back to you, and it haunts you and it affects you, and it is really draining. It it is very exhausting at present, and we're trying our best. You know, Especially being an emergency physician, we've been trained to go through this, but it takes a toll. It takes a toll, and a lot. I think recently we also had we heard news about a doctor who committed suicide because he just couldn't handle the pain anymore. So it's hard. It's very hard.
Are there any cases that you've seen at your hospital that really stand out for you that have stuck with you?
Multiple, especially when they're younger patients. When they're younger patients, and um, you can see them deteriorate bit by bit in front of you, and um, they come in talking to you, and they say stuff like, "Please save us. I don't want to die." So then, yeah, it stays with you, and we get affected a lot. We might shake it off at that time so that the patient care doesn't get affected, but um, it comes back to you. It haunts you.
Are you worried about your own personal safety? Are you worried about being infected yourself?
Um, uh, partly, because I guess more than myself, I'm worried about my family because there is a constant fear of getting infected. I go back home. I don't want to take the infection back home to my family. Um, and but somehow we try to override this by distracting ourselves, keeping our spirits up and getting involved in patient care. So there is a constant fear. In fact, right now I am I am distancing myself from my family at home, and your family is your support. So I don't. You kind of need that support, but on purpose I have to keep it away. So I'm missing that part of emotional support which I should have. But we're trying hard. We're trying hard.
How are you and your staff coping during these times? You said that you're not getting the full support from your family because you are distancing yourself. So how are you finding that support?
So we're keeping each other's spirits up. We keep pushing each other. It's difficult, but we try to keep each other, make each other smile or make them laugh. Try to keep each other's spirits high, which is very important. I don't think we would have made it if we didn't have each other. So I'm blessed to have a very nice group and my colleagues. So that way we keep pushing each other, and that is how we've gone through this. We've been through this once last year. This year it's come with vengeance. It's much bigger, enormous, but hoping that we get through this again.
How has it been different between the two waves? I understand that more younger people are actually getting infected. Are you seeing this?
Yes, we are. Not to say that the older geriatric or the elderly group is not getting affected, but compared to the first wave, we're seeing a few younger patients come in with symptoms, young as early 20s, very young, and it's killing them. It's killing them. I don't know if it's because of the fact that the geriatric age group or the elderly got vaccinated early, or the fact that the younger age group are not social distancing or following the norms. But I'm not sure what the exact reason is, but yes, we are seeing a lot of younger patients now.
And what do you need at your hospital right now? What do you need to be able to see all these patients?
I think any hospital, we need, you just need more infrastructure. You need more beds, you need more oxygen, you need ventilators, BiPAP machines. And this goes for every hospital. And the fact that it is a pandemic, this goes for every hospital. This is what we need. We need more doctors, more nursing staff.
I hope you get more support as well. The pictures and the stories coming out are horrific. Thank you so much for sparing this time to speak to me. I know you're very busy. Thank you.
Thank you so much, Alkira. Thank you so much.